Hi, John Sample. How are you? I'm so glad you came back for sessions in which we can discuss the results of the assessments you took. If you have any questions at any point, please feel free to ask. And I will start with the Beck Depression Inventory. That's the first one you filled. You scored 32 on that one. And soon we'll get to what it means. On the Beck Hopelessness Scale, you scored 13. On the Beck Anxiety Inventory, you scored 18. And on the Beck Suicide Ideation, you scored 2. I know those numbers don't mean anything to you yet. Yet I wanted to discuss with you a point that I need you to help me clarify. So if we're looking at the comparison between the scales, there's kind of a conflict between two inventories that you filled up and they contradict each other. The BDI, the Beck Depression Inventory, you answered that you are considering to kill yourself, and that puts you in high risk for suicide. You are really in a severe risk for suicide based on that. You are on the 99th percentile, and that means that you are 99% above, that 99% of the population is below that risk. And on the other inventory, on the other hand, on the Beck Hopelessness Scale, you answered questions that contradict that. You said that you would not kill yourself, and you answered some other questions that take away the severity that you answered in the first assessment. And I'm not sure about what is it. Maybe the questionnaires were not clear to you, maybe you were confused, and I want to help you clarify that, and I would appreciate if you clarify that to me as well. So on the Beck Hopelessness Scale, you rated moderate, and then on the Beck Anxiety Inventory, you also rated as moderate risk. Now, the difference between the high steep and the moderate one could be an alarming sign if there's an impulse that's involved here, and in your case the drop is not too steep, so I am less concerned for higher risk by you. But when the BHS is significantly steep, then there's that risk that you don't have, thank God. Now, your age and the fact that you're married puts you also on a low risk. So I would really like to hear what you have to say about the difference between the two scales. And then there's the graph of the BSS, the Beck Suicide Ideation, and that shows that you are scoring 2 out of 35, which is also a score that puts you, it does not range, the diagnostic range is not specifying what it means. However, I would like to discuss these with you, and some other things that I wanted to clarify for you are, do you have any questions? Thank you, John Sample.